Welcome back. We are continuing our focus on Healthy Heart Month right now in February. Recently, I spoke with Dr. Bland and Pamela, a patient, all about artery disease. Let's take a look.
It's Heart Health Month and an important time to talk about artery disease. Artery disease can affect more than just your heart, and early detection is key to reducing the chance of serious outcomes. Here to talk about what you need to know about coronary artery disease, or CAD, and a related condition called peripheral artery disease, PAD, our family physician and renowned hypertension specialist, Dr. Veita Bland, along with PAD patient and advocate Pamela. Thank you so much, both of you, for being here today.
Thank you for having us.
Thank you for having us.
Dr. Bland, what are CAD and PAD, and what do people need to know about the link between the two conditions?
Well, when we typically think of heart disease, we typically think about coronary artery disease, the arteries of the heart. And unfortunately, there are cases where the blood supply doesn't get there the way it should. There could be obstructions. It could be from cholesterol. It could be from plaque. So the blood doesn't get to the heart in the manner that it should. When this happens, though, we see, unfortunately, heart attacks. We see also strokes. So we know that there's a consequence that that blood doesn't get there. When we see PAD, that's peripheral artery disease. And what that means is that the legs, the feet, they're not getting adequate blood supply. When this happens, it's serious because you could lose a leg or a foot behind this. What also people need to know is that 40% of people will have both PAD and CAD. And these are the people we need to have checked on a regular basis and make sure that they are aware that there is a problem and it should be aggressively tackled.
Dr. Bland, who is most at risk for these conditions, and what can they do to manage their health?
Well, we do know that cardiovascular disease is unfortunately a problem that we see here in America quite a bit. But there are some risk factors that if you take care of them, that will help you take better care of yourself and decrease your risk of these things. Diabetics are particular people we worry about, people who have high blood pressure, people who have cholesterol issues. If you are obese, if you are sedentary, and if you are a smoker, those are some of the people that we worry about the most. Additionally, people of African American descent, unfortunately, have more coronary artery disease, have more hospitalizations because of that. And also people of African American descent have more peripheral arterial disease. They have more asymptomatic peripheral arterial disease, meaning they have no symptoms. They have no idea there's a question here that needs to be answered and taken care of. To this, though, we see a four-fold increase in the number of amputations that people have because they are not aware that there are problems there. They have no problems with pain in their extremities or their legs. They have no problems with hair that used to grow and now doesn't grow anymore, or toenails that look different, or a toe or foot that turns colors, turns blue or purple. They have none of these symptoms, which puts them at increased risk, which is why they also need to be treated and seen on a regular basis.
Pamela, you were diagnosed with PAD. Can you tell us about your experience?
Absolutely. I was diagnosed in 2009 when my daughter noticed my toe being purple. It was at that time that she insisted I see a physician. I saw a vascular surgeon, and that day I had emergency surgery and for a blockage that was in my leg, and it saved my foot.
And Dr. Bland, what's the benefit of early detection, and how can healthcare providers and patients have these conversations?
So very important. It's important to be proactive. So the earlier you see about something, the better it is for you. The less severe the problem may end up being. So if you have these risk factors that we spoke about earlier, you definitely should go in and see your healthcare provider. Go in there Take your shoes off, take your socks off, don't care if your toenails are painted or what. Let them look at your feet and determine if there is an issue. And if there's an issue, address it. So it's really important that you go in and speak with your healthcare provider. Have a heart-to-heart about what's going on and make sure that this is taken care of. This is nothing to play with.
Pamela, what message do you want to share with our audience today?
I want to share with them the importance of getting educated about vascular diseases. Talk to your doctor. Find out what risk factors you have. A great resource is vascularcures.org. I gained so much understanding from there. They have information on vascular arterial diseases.
Well, thank you so much, Pamela and Dr. Bland, for joining us. I really appreciate this important information for Heart Health Month. Pamela, really thankful that you're willing to share your journey with us and really know that you'll help a lot of people, and great to do during Heart Health Month. So thanks again for your time.
Thank you so much.
Thank you.